Hey there, everyone, and welcome back to the Reflux Revolution podcast. I'm Molly Pelletier, registered dietitian, leader in nutrition for reflux, GERD, LPR, and the founder of FLORA. Also, a former GERD sufferer myself. So, this podcast is our mission to help you find real, long-lasting relief. And in this podcast, our goal is to cut through the noise, provide practical evidence-based strategies, giving you the tools to understand and manage your reflux. Today, we have a very special guest. Here with me is Kimber, one of our expert reflux dietitians here at FLORA, and we're going to be diving into the topic of pregnancy reflux. Why does this happen? What we can do? So thanks so much for joining us, Kimber. It's so lovely to have you.
I'm so excited to be here.
I'll let you give a little bit of a background of who you are because it's your first time on the podcast. So I think our listeners would be so interested to kind of hear a little bit about your background.
Absolutely. So I've been a dietitian for the past 6 years. And in those 6 years, I've worked in a variety of settings, everything from inpatient clinical, working in the ICUs during COVID, to then outpatient oncology, then transitioned to more private practice, functional medicine. And now I work with FLORA, really specializing in gut health, reflux, and everything that encompasses that population.
Awesome. So with pregnancy, this is a question we get all the time from our clients. We do have a lot of pregnant clients, people who are thinking about pregnancy, maybe are navigating reflux, and then they're also, thinking about pregnancy, or the opposite. Maybe they become pregnant and then reflux has become a major problem in their life. So I want to start by talking about kind of why reflux happens during pregnancy. One of the biggest components is progesterone. So progesterone is this hormone that it slows down motility. So it slows things down. And motility is how quickly things move through our digestive system. When things slow down, it can increase the risk of reflux, but it can also impact the lower esophageal sphincter.
Yeah, contributing to that relaxation of the lower esophageal sphincter. So it makes it easier for reflux to actually occur as stomach acid or just stomach contents in general flow back up into the esophagus. And those changes generally happen more so in the first trimester. And so before baby has really even begin to grow and put too much pressure, people can still experience reflux in the first trimester based more so on those hormonal changes than the actual space in there.
Exactly. Yeah. First trimester, we're thinking optimizing motility, optimizing that flow of food in a downward motion. And then that third trimester is when we're getting a lot of pressure on the stomach. So the growing baby is increasing gastric pressure. Anything that increases gastric pressure is going to impact the way the lower esophageal sphincter functions. So we might be thinking about, smaller, more frequent meals, things like different things that may help with reducing that pressure in the third trimester.
Absolutely. And it can be frustrating too from, the perspective of a pregnant woman who's also dealing with things like increased metabolism, trying to make sure that they get enough nutrients in order to support growing and developing fetus and making sure that they themselves have enough nutrients overall to also help prevent weight loss, especially in that first trimester. So throwing in like cravings and body changes, it can be a really stressful period as well.
Yeah, there's a lot of hurdles. We want to make sure we're getting enough nutrition. And then when it comes to the reflux triggers and the cravings, sometimes those don't always align. So we'll dive into the nutrition piece for sure, because I think meal planning is key. But before we do that, I also just want to call out how do you know you're having reflux? Because these symptoms might be new to you as a pregnant person. With reflux, we all know kind of heartburn as the typical symptom. But also, you might feel just a lot of nausea, bitter taste in your mouth, throat burn. Any other symptoms I'm missing that you can think of?
Well, I think the bitter taste, especially first thing in the morning, is a really good indicator too, because the nausea can absolutely, especially in that first trimester, just be more so that morning sickness component too. So if you're really trying to figure out maybe is it morning sickness that's to be expected, or am I having acid reflux? I think that bitter taste or a little bit more of that, sensation in the throat first thing in the morning can be a really good indicator that it is more so reflux than traditional morning sickness.
For sure. Yeah. Even things like voice hoarseness,
Mhm.
shortness of breath, voice changes, feeling like something is stuck in your throat. We do want to watch out for those too as signs of reflux. So yeah, let's talk about things like reflux triggers, like things that we may want to be careful about when we're pregnant. The first thing that kind of comes to mind is super heavy, large meals,
Yeah.
especially when we might be craving things that are like a little bit more fatty or fried. Those can be reflux triggers.
Mhm. Yeah, so definitely if somebody's having those pregnancy cravings for, fast food, sometimes that is your body's sign that it just needs a little bit more sodium. And we may be kind of mishearing it as far as, oh, I need, the higher calorie, higher fat foods. But because those higher calorie, greasy, fried, fatty foods can slow overall motility, that's definitely something that we want to limit or at least keep in smaller portion sizes during that first stage. I would never want to stand in a pregnant woman's cravings in the way of that, but maybe saying like, okay, I'm having a craving for french fries, but I'm not going to have the hamburger on the side of it, trying to manage those cravings so that you feel satisfied, but that you're also limiting things that are going to really exacerbate those symptoms overall.
Such a good point about the portion size. And because if we're really craving something, what we can end up doing is like eating everything first, and then eventually we eat the thing we're craving. So allowing yourself to have a couple bites of that, but not going like overboard, is a really helpful strategy here. And definitely thinking about timing too. Like if you are craving a big chocolatey decadent dessert or some french fries earlier in the day might actually work better. Because if we're getting that little bit of a loosening with the sphincter, having that earlier in the day gives your stomach more time to like empty before you lay down.
Absolutely.
So yeah, and then with caffeine, like we shouldn't really be getting a whole lot of caffeine when you're pregnant anyways. You can have small amounts of it, but that might be something that we limit as well, or maybe we find an alternative if you're having really severe reflux, something like Kamana or Ticino. Some of these reflux friendly drinks are linked on our recommended product page.
Absolutely. And when it comes to, alternatives too, because obviously in this time, not only are we managing caffeine intake, but there's no alcohol consumption. So I find too, a lot of pregnant clients may be dabbling more so in like mocktails and sparkling waters, but bubbles are also going to increase that pressure around the lower esophageal sphincter. So if you are reaching for an alternative like sparkling water or something, you can also try diluting it with a little bit of flat water, giving it like a good stir to help burst some of those bubbles. But we also have some really great mocktail recipes on the FLORA app, some good refreshers that also just help you overall to stay hydrated while limiting some of those other things that may trigger reflux.
Such a good point. I totally forgot about the mocktails on the Flora app are great for pregnancy, to have something that you want to drink, you want to bring to a social gathering. So those are really helpful alternatives.
Absolutely. And it can also just help overall because I find that, and this is coming from not just working with pregnant clients, right? But also having friends that are managing these types of social gatherings while being pregnant. It just helps overall to bring a little bit more joy to the occasion. So having something that is a safe go-to that's not going to lead you feeling frustrated, that you can enjoy things that maybe other people, will help overall limit some of the triggers while also just limiting stress about those factors.
Yeah, for sure. Going into a social event, knowing that you're going to have something you can eat, you can drink, really helps to lower that stress. So going to the Flora app recipes and bringing something delicious there is key. I feel like this conversation actually can apply to like the pre-period symptoms too. Like anytime you're in increased flare because of a hormonal shift. So a
Absolutely.
lot of our clients do experience that worsening of reflux the week before their period because of some of these hormonal shifts. So I kind of think like a lot of these nutrition strategies, especially kind of what foods to focus on instead,
Mhm.
can be really helpful in that PMS time period. So that being good complex carbohydrates, oats, sweet potatoes, rice, lean proteins, things like turkey, tofu, chicken, salmon. Those can kind of make up your meals, but then also thinking about good alkaline veggies. And sometimes that's the hardest part because we're thinking so much about what we can't have, but there's so many great alkaline veggies that they can still incorporate.
And foods too, because I know a lot of people will have really strong aversions in the first trimester, especially to things like meat. So I speaking to a lot of, clients who are pregnant, friends who are pregnant, they have such a strong craving for like fresh fruits in the beginning, which is great, but also making sure that if you are struggling with reflux, that you're limiting the total like citrus component, focusing on low acid fruits like bananas, brown pears, melons, dragon fruits. Those can be really helpful tools to have because it's going to help you overall with those cravings for a little bit more freshness while limiting any type of trigger.
Yeah, really, really good point about the fruit. And yeah, it really, and if you love things like, clementines and citrus, like, and maybe it's like that we just only put one mandarin orange in your fruit salad. Like we make a big fruit salad of the melon and the apple and pear, and then, really kind of not going overboard with those citrus. If this is new to you and you're like, I can't give that up. So this really good point though about the fruit cravings and the protein aversions. And then, with nausea, we do want to make sure we're getting enough protein. So maybe we're trying to like sneak in protein into a smoothie or some cottage cheese into your pasta sauce or something so that you're getting enough protein. Because if you're protein deficient, that's not going to be great for you or the nausea.
Yes, absolutely. Even stirring like a scrambled egg or two into like a rice bowl can be really helpful. Just a sneaky way to add in some protein without delaying that gastric emptying or exacerbating any reflux.
For sure. For sure. So that is helpful to kind of have an idea of what to eat. And then the timing makes a massive difference. So we might be used to eating, two or three large meals
Mhm.
before pregnancy, but when we're pregnant and we're dealing with reflux, the smaller, more frequent meal approach might be better. So thinking about, three meals, one, two, maybe three snacks, depending on what trimester you're in. Your calorie needs don't increase really until later in your pregnancy, but we do want to make sure that you're getting enough. And so I would think about those smaller, more frequent meals as your pattern.
Yeah, and that overall helps not just with the, making sure that you're getting enough calories in, but a lot of people do experience a little bit of weight loss in that first trimester based on morning sickness. So helping to optimize your body weight, making sure that you're keeping your lean mass, staying, maybe active as tolerated, but the small frequent meals is really helpful. And then later on, that's also helpful for making sure your blood sugar stays stable, especially for those who may have a little bit more of that gestational diabetes risk or have failed that glucose tolerance test. The small frequent meals scattered throughout the day also overall helps with stabilizing your blood sugar levels.
Yeah, yeah, totally. That's a really good point. And what we often call mealtime hygiene, I've started to more recently call this mealtime mindfulness because a lot of people don't love that mealtime hygiene word. So mealtime mindfulness or mealtime mindset is what I've been calling it more recently. And this is really, really helpful if you are pregnant because we do want to use these tools that can help you digest better, overall digestion, and reduce your reflux risk, which is the mealtime mindfulness tool. So chewing really well. When you chew well, this produces 30 to 50% of your digestive juices. So I know it can be really busy and stressful to manage your life and then also this pregnancy, but really slowing down, chewing well, eating slowly, trying to also eat not rapidly, kind of eating too quickly can be a really, really big reflux trigger. So taking your time is really helpful.
Absolutely. And going back to what you said about chewing, I love also how like the smoothies we have in the FLORA app do also say, chew your smoothies. And sometimes I feel a little silly saying this to grown adults to chew your food in general, but then also to chew on a liquid. But because smoothies are also going to be colder. So because it doesn't have that strong of a sense of smell, your digestive enzymes don't necessarily have that head start if we can't smell it and we're not chewing mechanically to produce digestive enzymes later on. So even if someone is having, more of a liquid meal in the form of a smoothie, still trying to chew that, or even pairing it with like a rice cake and almond butter, something that's going to require you to chew between sips to help overall slow down the absorption and the volume in your stomach.
Yeah, really important note about the volume. Sometimes we can get these really massive smoothies. I can't tell you the number of times clients have messaged me like, I just had a smoothie and I don't know why I'm having the worst reflux of my life. And sometimes it's because we drink them too fast, or it's just like so much liquid in the stomach. And then our sphincter, for whatever reason, pregnancy or anatomical reasons, is not closing at the right time. So decreasing the speed and really kind of making sure we're slowing down can help.
Absolutely.
Yeah. Um, Posture too, especially in that last trimester, is a big
Yes.
part of the mealtime approach. Is we're trying to, have good posture during the meal, good posture after. This is something that has helped a lot of our pregnant clients.
Absolutely. Staying upright while you're eating for sure, but then also for up to an hour after is really helpful. And, I think generally when we're talking to clients struggling with reflux, GERD, LPR, who are experiencing with those things chronically outside of pregnancy, we usually may encourage a time frame of try to finish dinner about like 3 hours before you go to bed. Maybe a little bit more challenging in pregnancy if you are dealing with higher metabolic demand, if you are dealing with gestational diabetes and need to have a bedtime snack before going to bed to make sure things stay stable. But I do still think that following that like 1 to 2 hour guideline before bed is really helpful depending on your situation.
Yeah, I definitely agree. And being strategic and personalized with that bedtime snack, if we do need one, like kind of focusing more on a little bit of protein, a little bit of carbs, and not having a super high fat snack before bed, watching the fat content at dinner is key, because that the nighttime is often a time where we're having a lot of reflux. And if our dinner is our biggest meal, lots of fat, that doesn't set us up for a good night of sleep. So elevating the head of the bed, or using like the pregnancy pillow actually is really helpful, because it already elevates you a little bit. You just need to probably put a pillow underneath the top of that C shape. That's actually what I used when I have really severe GERD, is a pregnancy pillow, and it kept me on my left side, which was really helpful, because you do want to be on your left side so that your stomach is sort of in that anatomical position to empty a little bit better.
Absolutely. And sleep too is such, an important key to healing in general for everybody, but even more important when you are trying to grow new life, right? So really ensuring that you have the proper kind of environment, making sure you're elevated, left-hand side, all of these things, and also making sure you're not wearing anything too tight that may increase some of that like pressure, not just at night, but throughout your day is also important.
For sure. That's a really good point about, not having really, really tight clothes. That's a trigger for all of our clients, even those who are not pregnant, is just really tight jeans, or tight things around the abdomen. So making sure you're comfortable there. Another strategy that for your meal times is that post meal walk. So research tells us that walking post meal can reduce the risk of reflux. And I think this is a great strategy, especially in the first and second trimester when we're trying to support motility.
Definitely. Overall, just helps things move the right direction because constipation is also something that you can struggle with in pregnancy. And so, if we are having more of that constipation, those effects can linger up, delay that stomach emptying. So, that short walk after meals is tolerated is great.
Yeah, that's a good point about the constipation, because it is so common, and it definitely worsens reflux. So, looking for signs of constipation, like if your stools are harder to pass, if you feel really bloated, if you feel like you're having a lot of unanticipated gas, like,
Uh, if
or
it's raining or dealing with
raining.
hemorrhoids, like those are very telltale signs of constipation. So, definitely something to um, make sure you're having adequate fiber, adequate fluids, and then that movement as tolerated after meals is really helpful.
Yeah, absolutely. And I wanted to talk a little bit about diaphragmatic breathing. This does apply to constipation too, because one thing that I've noticed helps our clients a lot from a previous podcast episode with Dr. Mukta, who's a pelvic floor doctor. She's talking about how diaphragmatic breathing on the toilet actually can be a good strategy for constipation. So diaphragmatic breathing really, getting your lungs to expand on the inhale. This is helpful in the scenario of constipation, but it's also helpful to prevent reflux. So diaphragmatic breathing post meal can tone and strengthen the sphincter. So this is another like free strategy that we can use post meal, just a few really deep diaphragmatic breaths.
Absolutely. And kind of expanding on that, I've had people try like the blowing through a straw as well. You take your inhale and then you exhale through your straw overall to help slow it down. So it can be helpful with that, elongated exhale in general, but also just overall setting a good environment around that, like toilet time, for lack of a better word.
Yeah, for sure. Like the mornings, oftentimes the morning is when we're trying to have a good bowel movement, and starting your day with deep breathing helps with stress, helps with anxiety, your nervous system, which we do want to continue to think about. I know we talk about it so much on the FLORA app and on this podcast, but we want to continue to manage stress and anxiety during times of hormonal shifts. We might be feeling a little bit more reactive, a little bit more emotional. So having practices throughout your day, whether that's in the morning, on your lunch break, in the evening, where we're intentionally de-stressing, it really should still be a part of your self-care every day.
Absolutely. And, wherever you can fit it in, right, is going to be ideal, because the more these practices fit in with someone's lifestyle, the less stressful it is to feel like you are having to add all of these new approaches and all of these new things that are going to take a little bit of time, but really don't have to set your schedule into too much variety.
Awesome. Yeah. Awesome. So for our last segment, let's do a little bit of rapid fire tips. And in this, we can talk a little bit more about supplements. I know that something comes up a lot with our clients who are pregnant. So what would you say is your best late night reflux snack?
Oh, this is a good one. So something that does have protein, a little bit of fat, but also does have some neutral carbohydrates. So a good example of this could be, a banana with a little bit of almond butter, or a rice cake with some avocado mashed onto it, something that's going to slow down the absorption of the glucose, but not so much to where you're delaying that gastric emptying.
Yeah, I tend to recommend things that are mostly protein and carbs. So I love rice cakes with cottage cheese, yogurt, a cheese stick and some crackers. If you don't do dairy, even something like oatmeal can be good. A handful of pretzels, something like a little bit more carb focused. And then something that is like easy to digest, nothing like super high in fat or raw. A little bit of fruit could be fine, but I wouldn't do any like veggies right before bed. But
especially some of those like more raw vegetables that just take a little bit longer for your digestive tract to get through.
Right. And what would you say is, so we talked about drinks already, go-to calming drinks that are on the app, but in terms of other things too that we could maybe find at the store for drinks, I would say the hint waters, the flavored still waters, those can be helpful. Also really love like iced hibiscus tea. Do you have any other favorite drinks?
So something that doesn't necessarily, replace the alcohol or the caffeine that we were talking about earlier, but just as like good in general, are those fortified plant milks, because they are also going to have the calcium, which is going to help overall neutralize the acid. So that can also be something good, later at night, if you do feel like you're maybe prone to refluxing, is having a small amount. You don't want to overfill the stomach and put pressure on that sphincter, but talking like a half glass of something like a fortified almond milk.
I love that. That's also a good tip for kind of combating reflux. Like because they're fortified with calcium, it can be a little bit of a antacid as well, because calcium is very alkaline. So having some almond milk, yeah. Or even like making a banana smoothie with the almond milk before bed, like that's a great thing too. So good tip there. How about, so let's talk about pregnancy safe supplements because this can be tricky. What are some of the most common supplements that you'll use with those who are pregnant?
So reflux raft is generally probably the biggest supplement that I will recommend in pregnancy, especially because there are so many supplements that could be beneficial, but there's just a lack of studies, especially in that population. So I generally will try to avoid supplements if I can help it, aside from the reflux raft, because it really does help overall create that physical barrier with the alginate to help reflux from occurring. And it's funny that we're chatting about this one specifically because I have a friend who reached out to me somewhat recently and said, like, oh my gosh, this heartburn is killing me. I've never felt this in my entire life. So I sent her a link and, she had really great experience with it. We talked a little bit about the mealtime hygiene and everything like that, but those are some things that I know she's already practicing. So the reflux raft was really effective for her in managing that, especially because this is a short term etiology to why someone's having reflux. So if we're not necessarily focusing on like healing mucosal tissue, if it's not chronic GERD, something that's developed over time, I really do find that physical alginate barrier can be helpful in this case.
Yeah, absolutely. Yeah, I love using alginates in pregnancy because if you're not familiar with alginates, it's basically just an algae that creates this raft at the top of the stomach and can physically prevent reflux from moving upwards. So if you're in the UK, something like Gaviscon Advanced is an alternative there, but you really want to look for the key word of sodium alginate. And reflux raft is the one we use. It's so helpful because you're right. There's so many other there's great things, but we want to just be the safest as possible approach for someone who is pregnant. So that's a great one. And then when it comes to constipation, really love using magnesium oxide or citrate to kind of help with motility so that we remove any barriers for motility with constipation. Usually we're getting enough fiber through our diet if we're working one-on-one, but considering a fiber supplement is also pregnancy safe. And then we can work with your doctor. Sometimes they'll recommend in an emergency situation something like Tums or Pepcid with your doctor.
Absolutely. And, going back to what you said about, fiber could be appropriate. It's just also ensuring that you're staying well hydrated between meals, because even if you are taking a fiber supplement, it may not work effectively if you're not well hydrated.
Oh yeah, hydration is key. So keeping your water bottle with you, sipping throughout the day for sure. For sure. So I feel like we covered so much in such a short time. I think this is an episode people are going to have to re-listen to because there's so much good jam-packed info. But I think, our key takeaways is that reflux is really common during pregnancy. We're just scratching the surface here, but there's so much that to support you, whether it's in your mealtime mindfulness or the foods you're choosing. There's a lot of swaps and supports that can help you get through this.
Absolutely. And it is temporary. So, understanding too that it very much is frustrating in the moment, but there are things that you can do so that you don't feel like you have a miserable experience, even in this short time frame.
So true. So true. So if you're looking for more support, reflux-friendly recipes, mocktails, there is a risk-free 7-day trial of the FLORA app in the description of this episode. But if you found this helpful, please drop us a comment, leave a review. Be sure to subscribe so that you stay up to date. And share this with a friend. Share it with a friend who might be struggling with reflux or thinking about getting pregnant so that they have it when they need it.
Yes, some good proactive listening.
Thank you so much for joining us, Kimber. This is really great to have you.
This was so fun.
Yeah, we'll see you soon.
All right, bye.